wise and the bright, old and the young. I hope you can see me. I can't see very well. I marvel the organization team of the young boys and girls who are doing these programs, and they deserve my congratulations. Whereas when I was looking through it, I realized the same thing replicates in all the spheres of life. And today I am going to lead you by another example which was mandated to us in 2008 and now it is a decade, how this one example could probably give a message, a learning experience into how health of this country can be improved. The disease I am talking about is hemophilia, which is a very complex disease, but it's a very scary disease. It bleeds a person to death. For us to survive, we need two things. We need the blood to keep moving. If blood stops, we get heart attack. If blood stops, we get stroke. If blood does not stop, then we get bleeding to death. And it can occur in accidents, it can occur at any other time. In this disease, there is a deficiency of a protein which prevents the blood from clotting. And these persons, like Dracula, if I can say, you can see that blood pours out of their body and they can bleed to death. Incidentally, this coming 2 weeks will also have the World Hemophilia Day, which we do with commemorate with it. And this hemophilia is a very fascinating disease. So apart from the example, I will give you a couple of these things. It's related to what we call chromosome, which is called the X chromosome or the sex chromosome. Women have 2 of them, men have only 1. Now this is one area where nature has empowered the women more than the men. Because of which, women, even if the X chromosome gets affected, do not show up the disease. Look at the nature's way of empowering them. Men, they have only 1, and if it does get affected, there is no escape. They have to get the disease. Now these are called the X-linked or X chromosome-linked disorders, and the common ones are the baldness that men face again, the blindness, color blindness which anybody faces, and the hemophilia that I am talking about. Hemophilia is a very old disease, and it became famous as a royal disease because Queen Victoria was noted to be the first one to have passed on this disease to the royalties of not only England, Russia, Spain, Germany. They did it, and they have controlled it also. I must be fair to them. It was not their doing. But what came out of this disease was more fascinating. This disease affects everybody across the globe in an equal manner, equal fashion. There is no caste, creed, preference. There is no geographical preference. Nothing to do with your poverty or richness. The incidence of this disease is seen across the globe. We have seen it time and again, and 1 out of 15,000 born would get this disease. This is the kind of bleeding that we see. It could be eyes, it could be brain, it could be chest, it could be abdomen, it could be urine, it could be anywhere. The most common ones are the ones that is the joints and the muscles. They just knock them out. The bleeding is inside, and the blood, let me tell you, you know about the blood, but the blood is good in the body so long as it circulates. The moment it stops circulating, it is bad. A joint in which a blood bleeding occurs, and the bleeding, let's say, stops within minutes, would become bad for years to come. Because the blood that exuded out into the joint becomes a poison for the joint. It's very important that we make sure that this bleeding does not occur. So it's a disease which goes all over, and it occurs because of the deficiency of a protein in the blood, which was numbered as they were discovered, and the deficiency is from a coagulation protein called protein 8 or protein 9. One is named as A, hemophilia A, one is called hemophilia B, so that the treatment becomes very easy. Look at the colorful artistic model that has been drawn up for this clotting factor. This is the ribbon model, and what you see here are the places where the changes occur in these hemophilics so that this protein becomes non-functional or dysfunctional, and this is a chromosome. Another fascinating thing, you don't need to look at the complex picture, but what you can remember is this color, the blue one, shows a normal human being. So this is a normal man, the father, and this is the mother who has got one X chromosome affected by hemophilia. Now look at that. This person, the gentleman, is normal. This lady is normal. She has no problem when you look at her, talk to her, or do anything. But one of their son, 25% chance, would be having hemophilia. Nothing in the family, it shows up. But it was there in the family, one may not realize it. There is another one here where the red one is a diseased father. And look at them, they still would have kids who would be free from the disease. So the disease will show up in a manner which a common man will appreciate. The fact also remains that this disease is very killing. Still it remains in our society, in the world actually, in the population. And what has been realized is, even when it is bad, and the bad disease means these patients will be killed, the new ones come up. So on one hand, we have the old ones going away because of the disease, and on the other hand, we have the nature bringing in new ones. That was best shown by this man, J.B.S. Haldane. He was a Britisher who moved out of Britain 1956 for a different reason, and he became head of the Indian Statistical Institute till he died. He actually became a naturalized Indian. He loved Hindu mythology. He loved everything of India. And he said there is no country better than India. He was such a great fan that the Nobel laureates would say, we have not seen a better science propagator than him. He was the one who gave this formula of why hemophilia, you have these mutations which are not good for survival. They sustain so that the balance in nature remains and hemophilia remains there. This has an implication. This is what he was talking about, that you have some mutations which try to come up to bring the disease, and these nature wants to select so that it is curtailed and the balance is maintained at the same level, that is 1 in 15,000, let's say. This has an implication. Nobody should think, my family, nobody has hemophilia, so it will not occur. 1 out of 3 would develop a new change, a new mutation. It can affect any family. One should not think like that. That being the background, how much is the problem here? I have worked out with our current growth rate coming down, thankfully, we would expect about 1,200 new persons coming up with hemophilia. They would survive. The total that we expect, this is a new one. Earlier on, we used to talk about 1,500, 1,600 when the growth rate was high. So we would expect about 1 lakh to 1,25,000 of them roaming in our society. Whether they are taken care for or not is what we are going to talk about. Remember, providing treatment to these persons with hemophilia is a matter of state subject. So those who are born in Delhi would be looked after by Delhi government, and so also for the remaining 29 states. We started this in 2008. This was a center we had in Maulana Azad Medical College, and this is the background under which we started. We didn't know how many patients we will get, how much treatment we will get, and this was actually mandated to us by the Honorable High Court of Delhi. And when we started, we were given a dark room, which when we opened, only the mosquitoes came out because it was locked up for a decade. But we kept doing with our center, and we developed few of these small basic things which we thought were necessary. We called it a hemophilia daycare center because we are looking after the day care of these patients. We didn't know there are too many. We are now thinking of making it 24 hours. we had the nurses coming in, and we were told that you should take specialists. Now let me tell you that hemophilia is looked after by the World Federation, an affiliate of WHO called the World Federation of Hemophilia. They came to us, they told us you need hematologists, you need hemophilia specialists. We said no, we need basic MBBS doctor and we shall train them. And these are the doctors that we trained there, and they became the best that we can think of, and even the world would appreciate them. We said we need these nurses. Look at them. We need these nurses. And for a change, we said the charge of that hemophilia center would be given to the nurse. We came up with the name, we came up with the logo, we came up with the philosophy that will give treatment to all those who need and get a protocol in place. And we did very well. We did very well, keeping in mind that at that time we had undertaken a study in 5 developing countries, South Africa, Algeria, Morocco, Oman and India, and we found that 70% of these persons had disability, 84% had disabled joints, and everybody had to travel long distances to get some care. In that scenario we were working, and these are the guys who visited our center later on and saw what we were doing. This was happening at a time when a good treatment was available for this treatment, for this disease. So you give an injection of the deficient protein and the person becomes right. How do you give it? It's like diabetes. Diabetes is deficient in another protein called insulin. What do? We give them insulin injection. Unfortunately, the world was not giving those injections on a regular basis, and the World Federation was calling it a prophylaxis, which did a lot of harm to the cause of hemophilia. It should simply have been called replacement therapy like diabetes mellitus. We started it and patients started flowing in. We didn't advertise anywhere, but the patients started flowing in. When the patients were flowing in, look at this chart. This is the age of the patient and this is the weight. We had all the data captured on electronic format right from the beginning so that we can do a real-time analysis. But the point I'm making here is, each dot is representing a patient that time. Look at all the dots. They are concentrated under 18 years, 20 years. Most of these dots, indicating that most of the patients that were coming to us were young. Why were they young? Not because the younger population was affected more by hemophilia, but because the older ones did not survive, which was a very good reflection. And the second we found that majority of them were school going. Now this was helpful to us in taking up another project later on, which would help the school students. But our treatment was very successful. This is a rise which we were taking for the treatment of these hemophilia patients, and the numbers were going up so much that when we started with 2.5 million as our budget. And now we were talking about 70. And nobody was unhappy giving it because it was bringing such good results that the feedback did not come to us. The feedback went back to the administration, to the society and the World Federation. We realized one more thing. Just giving simple treatment, I know diabetes has got insulin deficiency, I prescribe insulin, that will look after it is not the truth. We have to go beyond. We have to learn from the patient needs. And we realized their disability can be looked after not by the drugs, but by the physiotherapist. We are doing such good work that a physiotherapist came and wanted to work in our center. We said, we have no money. She said, no problem. 3 years she served there and brought in monumental change in the health of these persons. Later on, we could keep one against a money. But this became very important. We also realized there are social issues, psychological issues, which we handled. And this is the time we became more aware of them and we started interacting with them on a regular basis. And then realized they have other problems which are not part of hemophilia, but it's part of their body. And those diseases became quite important. And looking after them made the life of these hemophilics very easy. These persons were taking blood or blood products until that time. Since they were taking it, they were at risk of getting infections which are associated with blood. And one of them is hepatitis. Hepatitis has got a very good vaccination. But the vaccine can be given only to the muscles. You give an injection into the muscle of a hemophilic, the person will develop a big bleed there, hematoma. It is not to be done. And the vaccine was shown to be effective when given through deep intramuscular, which means into the buttocks. We gave it under the skin, under a controlled research project, and found it is 100% safe, effective, and seroprotection, conversion was so good that ever since we've been using this mode for their vaccination. From there, we did at least 24 projects based on their needs. And one of the ones that I would like to highlight is, we undertook a project wherein we tried to develop the index and the scales for assessing the disease burden from hemophilia in developing countries. And this was presented, and I wish this would come up because that will give us a way of monitoring them in a horizontal manner and a vertical manner together. That is the time when we started interacting with them twice in a month basics. So we would have a group of 25 to 30, it would stretch to 40, and we would interact with the families and the hemophilics on a theme project. So we would give them a theme, they'll come up, they'll participate, and we realize more and more about their problems. We realize the problems of those sisters who were not diseased, who were only carriers, but they are so much concerned. Then we entered into something which is called patient empowerment, patient satisfaction, and patient centeredness. We created a self-help group for hemophilia for them to take our motives there and bring their cause and difficulties to us. The more we met, the more we get. And we would meet not only twice in a month, we would also have a commemoration or every World Hemophilia Day, and at least once or twice in a year separately. So you can see them, they are all dancing around, and they could do so well, they sing so well, and on our part, our hemophilia staff was so good. Look at the face they created. From the questions, what these persons would tell us, what do I know, where do I go? And all those questions were put into the form of a face, which became the logo for our information brochure on hemophilia. In 2012, we competed globally for a project in hemophilia, and we were awarded the global project from the Switzerland. They funded it also, and the project that we proposed was Yoga Sutra in hemophilia. It became a big success story. We moved it further, and we had a painting competition, we had a essay competition, vibrant colors of life with hemophilia, hemophilia ke sang, jivan ke rang, and then we have the Mera Anubhav, my experience with hemophilia. They are still with us, very encouraging for the hemophilic community. We made the nurses pivotal. As I said, it was under their chart, and then we moved a step further. The injection has to be given into the vein, unlike the diabetes where it can be given under the skin. Once you give it into the vein, that is a big problem. Some of the hospitals, even the nurses refuse to give it. And we had the small kids. So we decided the smaller kids, 10 to 20 years, we would train them into self-infusion. And we did this in batches after doing a very structured analysis of how it can be done, because there is not much literature available. And we have trained at least 100 of them. You can do it themselves on their own. When they go to a place, different place, they have no problem injecting it. They go to Kerala, they have the injections, and they could not get it in Gateway. Now they can do it. The problem that we faced was patients from outside Delhi started coming in. Delhi was constituting only 1/3 of our patients. They were coming from outside. So we went out. We went out to the neighboring states, Haryana, Jammu and Kashmir, Madhya Pradesh, Andaman Nicobar, and we created these programs so that they could set up these clinics. This was taking the load off. One more problem was coming. We have these patients coming from Nagaland, where they would have a setup, and coming from Nagaland would mean the damage was ongoing when they travel for hours on end. So we took up this slogan of one country, one treatment. That's because there should be no delay in the management of this. And this program we took up at a national level, starting off with the Rajghat, and some of them supported us. And we started doing national level meetings and conclaves under 10 different heads. These are the 10 hats program we created, hemophilia awareness and training systems, and these were so successful, we had to collaborate with other institutions in the country, that now most of the states provide some kind of hemophilia care. When we started 2008, there were only 2. Not only are they providing the care, but it is bringing in a lot of collateral benefits. What collateral benefits? We have found that the labs that are required are the ones that test for the population, and when the mothers who are pregnant, they die, they have a high maternal mortality in this country. When they die, the single most important cause is bleeding. And when we set up the labs for the bleeding and the treatments for bleeding, the mortality would come down. So I would state that with this disease that we started, we were able to create a palpable impact across the country, and we learned ourselves. We became so much aware of the patient's needs that we started coming out into the public fora for other diseases also. That is where our involvement is. And the last, President Kalam was invited to one of these programs in Chennai, and one of these students, boys, asked, "Sir, what do I do if I go to space and I have to inject this clotting factor into my body? The syringe will fly away, the needle will fly away, what do I do?" And he said, any disability increases dependence and reduces self-esteem. Have an aim in life, acquire knowledge continuously. Education will build your self-esteem and will give you wings to fly. And we had a program called I Believe I Can Fly, which supported these children through their school. Thank you so much.